We're also seeing that people can text 911 in an emergency, and some crisis hotlines offer similar features like live chat. So how are resources adapting to our tech-driven world nowadays?
They're trying, but we still have a long way to go. So for example, if you're texting 911, I think one of the main, make sure you text your address, even though we do have, from somebody else's phone, you can know where one of your family members
location
is.
services, right.
But as of now, most emergency services do not know where you're at. So make sure you text the address if they, for any reason they need to be able to reach you.
That's a good tip. Now, Amy, I want to ask you, but in the case of communicating with a patient, how is it different to do it, let's say, via smartphone or via in person?
Wow, so, it becomes different for the clinician because we have to be paying a lot more attention to what's going on. We don't have the capability to have the physical interaction that we normally would. And so it's up to us to be able to create a welcoming environment. Even though we are, looking at each other through a screen, there's still a comfort level. So it's really up to us to say, how can I make you feel comfortable with me in the short time I'm going to be able to see you? And then also me paying attention. I mean, we do as therapists all the time, but really paying attention to body language, tone of voice.
Because they're not in front of you, so there needs to be a connection made.
Exactly. And even, really working on communication skills and letting the other person on the other side, hey, I notice you're not looking at the camera, because we have a tendency to be looking at, our keyboard or doing other things. So it's really important for healthcare providers to really be paying attention to that camera, and for the clients or the patients on the other end to let us know, hey, I notice you're not really, looking at me, and maybe you're distracted, but could you make more eye contact? So working on that communication is really key here.